Before we begin, let's review the indications for suturing. Sutures are appropriate when the depth of the wound will lead to excess scarring if the wound edges are not properly opposed. Typically, this is when the laceration extends through the dermis. Before you begin, make sure the wound has been cleaned with betadine or chlorhexidine and anesthetized. To numb the skin around the wound, you can use injectable lidocaine, which will last about 1 to 2 hours, or bupivacaine, which will last about 2 to 4 hours if longer pain control is needed. Also, make sure the proper time frame is met. Wounds that have been exposed to the environment for longer are at risk for infection if closed. The general rule of thumb for primary closure is 12 to 18 hours for wounds on the trunk or extremities and 24 hours for wounds on the face or scalp. This is because the face has a rich vascular supply which will help heal the wound. Make sure there are no contraindications to suturing, such as concern for infection in or around the wound, foreign bodies in the wound that can't be removed, or the wound is still uncontrollably hemorrhaging. Also, if you have an uncooperative patient, it's going to be really hard to suture. The first type of suture we are going to review is the vertical mattress. You should use the vertical mattress suture on wounds with edges that need to be everted, wounds that require more attention to close, and wounds found on concave body surfaces, such as the neck or dorsum of the hand or elbow. To place a vertical mattress suture, you can use the far, near technique. Begin with the far placement by placing your needle forward in the needle driver and digging into the skin about 4 to 8 millimeters from the wound edge. Make sure to go deep into the wound below the dermis. Your next bite will be on the opposite side of the wound, the same distance from the edge. You will then do the near throw. Reverse the needle backwards in the needle driver and take a bite 1 to 2 millimeters from the wound's edge and about 1 to 2 millimeters deep into the upper dermis. You will then pass back to the initial side where the knot will be tied. Next, we will review the horizontal mattress suturing technique. Horizontal mattress sutures are used on wounds where the edges need to be everted in order to spread tension along the wound, as a holding or anchor suture to hold skin flaps in place, to close wounds that involve large amounts of tissue, or on patients with more fragile skin, such as those that will not hold a simple interrupted suture, like skin of the elderly or chronic steroid takers. They are also a good choice for areas of thin skin, like the finger or toe web spaces. To begin the horizontal mattress suture, the needle is initially placed forward in the needle driver, and the first throw is passed about 4 to 8 millimeters from the wound edge, deep in the wound below the dermis. The needle is then reversed, and the next pass is placed 4 to 8 millimeters along the wound edge on the same side. The needle is passed through the wound, and the knot is tied on the same side as the initial pass. Remember to talk with your patients about possible complications of mattress sutures. When tying your knot, make sure that the knot is tied snugly but gently, because excessive pull on the knot can cause excessive tension on the wound, which leads to scarring or necrosis. Natural wound healing and inflammation can cause unattractive scarring, such as cross-hatching, railroad tracks, or Frankenstein face. Therefore, mattress sutures are typically not used on the face for cosmetic purposes. After you're all done, remember to send your patient home with follow-up instructions. To minimize scarring, vertical mattress sutures need to be removed from most wounds in 4 to 6 days, while horizontal mattress sutures can be removed as early as 3 to 5 days. Before your patient leaves, make sure their tetanus shot is up to date. Apply a small amount of antibiotic ointment over the suture line and cover it with dry gauze. Tell your patient they may remove the dressing after 24 hours. The wound can then be washed with gentle soap and water, but the patient should be advised not to soak the wound in the bathtub or pool. Make sure to let your patient know to return to your office or the ER if the suture area shows any signs of infection, such as redness, tenderness, or swelling.